Now let's go back to Australia. A Sydney Health expert discusses the impact of the pandemic on mental health. Regina Harige joins us or reports from Sydney.
As COVID-19 continuously rising across the world, each country has imposed strict guidelines and protocols to control the spread of the virus. In the Southern Hemisphere, particularly here in Australia, the federal and the state governments are managing this crisis with the best that they can do since the World Health Organization declared COVID-19 as a global pandemic. The public still encouraged to be vigilant and practice social distancing and to follow the government's health advice. However, statewide differences has been observed across Australia as state of Victoria battles the increasing cases, making it the epicenter of COVID-19 spread in Australia in the last week. With this stricter travel implementation, it is anticipated that already negative impact of this crisis on people will be even more aggravated, particularly everyone's well-being. To help us understand more on how COVID-19 impacts on one's well-being and give us some strategies to manage this impact, we have here Dr. Jed Monteiro, who is a health researcher and is currently doing some research on this issue. Dr. Jed, what do you think is the impact of these increasing cases of COVID-19 in Victoria to people's mental health well-being now that people from New South Wales have started to enjoy outdoor activities after lifting several restrictions?
Well, it would vary depending on people's individual circumstance. However, the greater impact could be observed among people who are already been feeling isolated in the last few months and have anticipated that they can be more social and be more mobile this time. But with the travel restrictions and even the borders closing, families, loved ones who are located in different states may have to wait until the restrictions are over in order for them to see each other again. That in itself could add additional, well, it's more stress to people, and especially it affects their mental and health and well-being. And there has been people who've been anticipating these restrictions to be lifted, and they might want to rejoin families in terms of going to another state for weddings, birthdays, and all of those activities. But unfortunately, because of the borders closed, then they have to wait and postpone those events. That can add stress and may impact on people's mental health.
What are your advice for people who are more at risk of experiencing the extreme impact of these recent changes?
Well, my take on this is to follow the government's health advice. But for those people who are really feeling isolated and who are wanting to be reunited with their families, who are currently in different states, it is best to use the existing technology in order to connect with their families. And also in order for us to improve our mental health and our well-being, it is good to utilize the local resources, maybe as simple as walking in the park or having some exercise. That will really improve our mental health.
Thank you, Jed, for your time.
My pleasure.
That is all from me with the latest news from Sydney, Australia. Regina Harige, Eagle News. We live in interesting times.